how does the presence of comorbid conditions influence the management and treatment of these patients with these type 2 inflammatory diseases?
I think that's key. And this was one of the reasons I was discussing this with the ENT fellows, is that you have a patient with asthma and chronic rhinosinusitis with nasal polyps. If you look at the data, that patient's asthma that has the nasal polyps is much more severe than the group that has just asthma alone. So there seems to be this compounding factor here that if you have more than one type 2 inflammatory conditions, those conditions tend to be much more severe than if you just have one isolated condition. And I think that's extremely important because it determines for me how aggressive I want to be in the management of that patient. So I may not treat as aggressively that patient with asthma alone versus that patient that comes to see me that has asthma and nasal polyps. So I think it's a real key here as far as learning about the severity of their condition and, again, how aggressive we need to be in the management of their condition.
And one of the things that we hear often is that type 2 inflammation actually occurs more often in those patients with moderate to severe disease in general. Is that accurate?
Yes, so we do see that, at least in the US and the population that we're dealing with. It doesn't mean that patients that have non-type 2 asthma cannot have a very severe disease. And in fact, some of my most severe patients have been non-type 2 and have been steroid dependent. But nevertheless, I do see these that especially have a lot of comorbidities. They tend to be the worst of the worst.